بسم اللہ الرحمن الرحیم. ویلکم ایوری ون ونس اگین ان اوور پاتھ وے جرنی ٹو یو کے. اور ہمارے آلریڈی 4 سیشن ہو چکے ہیں اور یہ 5واں سیشن ہے. اور میں بہت انٹروڈیوس کروانا چاہوں گا ڈاکٹر محمد احسن وقار، جو کہ ہمارے ہی لمس کے ایلومنا ہیں اور وقاص بھائی کے بیچمنٹ تھے ڈاکٹر وقاص کے. انہوں نے ماشاء اللہ MRCS کلیئر کیا ہے فرام ایڈنبرگ، اور ابھی FCPS بھی ان کا ماشاء اللہ پارٹ 1 کلیئر ہے، اور ان کی ٹریننگ شاید کارڈیولوجی ڈپارٹمنٹ میں چل رہی ہے، طبا انسٹیٹیوٹ کراچی. اور میں سب سے اچھی بات یہ کہوں گا کہ یہ ہماری وائلڈ کارڈ انٹری ہے. کچھ آڈینس نے فرمائش کی تھی گروپ میں، MRCS کے مختلف لوگ پوچھ رہے تھے، تو جب یہ بات احسن بھائی کے کانوں تک پہنچی تو انہوں نے کہا کہ نہیں، فرمائش پوری کی جائے گی. انہوں نے خود والنٹیرلی کہا کہ سیلف لیسلی کہا کہ میں یہ سیشن لینا چاہتا ہوں. اور ایک لیڈر کی یہی نشانی ہوتی ہے کہ وہ اپنے کمفرٹ زون سے، باکس سے باہر آ کے لوگوں کی ہیلپ کرتے ہیں. تو یو آر این امیزنگ لیڈر، اور بہت مجھے زیادہ خوشی ہو رہی ہے آپ کو ویلکم کرتے ہوئے. زیادہ وقت نہیں لوں گا، آگے کا سیشن آپ کے حوالے ہے. ٹھیک ہے ایسا.
السلام علیکم ایوری ون. آئی ہوپ کہ آپ سارے مجھے سن سکتے ہیں. اینڈ ہیلو، میرا نام ڈاکٹر محمد احسن وقار ہے اور میرا تعلق اسی بیچ سے ہے جس کے کافی لوگ اس وقت UK میں موجود ہیں. وقار سے میں جو ایک ایسی پرسنالٹی ہے جسے ہم سب جانتے ہیں، انہوں نے ریکویسٹ کی مجھے اس سیشن کے لیے، اینڈ آئی واز لائک کہ آئی وانٹ ٹو ڈو اٹ فار پیپل اراؤنڈ. اس سیشن میں ہم جو چیزیں ڈسکس کریں گے وہ بہت بیسکس سے شروع کرنے کے بعد اپ ٹو دی ایکسٹریم لیول آف کلیئرنگ ایگزام. ہم اپنی ڈسکشن کو لمیٹڈ رکھیں گے اپ ٹو MRCS، اور ہم MRCS کے دونوں پارٹس یعنی کہ پارٹ A اور پارٹ B کور کریں گے. لیکن سب سے پہلے میں آپ کو انٹروڈیوس کروانا چاہتا ہوں خود کو. آئی ایم ڈاکٹر محمد احسن وقار. آئی گریجویٹڈ ان 2019 فرام لیاقت یونیورسٹی آف میڈیکل اینڈ ہیلتھ سائنسز جامشورو. I'm currently working as an FCPS resident in Tabba Heart Institute, and I'm in the Department of Cardiac Surgery. I've done my 2 years general surgery training from Civil Hospital, Hyderabad. I gave MRCS Part A in January 2023, and I gave that from Royal College of Surgeons of England. Then I appeared a few months back in the month of February 2024 for MRCS Part B. That was from the Royal College of Surgeons of Edinburgh. Alhamdulillah, both of those of my attempts were my first attempts, and I cleared those, Alhamdulillah. اچھا، اس ڈسکشن یا اس سیشن کے دوران ہم لوگ بہت ساری چیزیں جو ہیں وہ اوور لک کر دیں گے. لیکن ان کیس آپ کے ذہن میں کوئی بھی سوال، اینی کوئری اور اینی انفارمیشن یوڈ لائک ٹو ہیو اباؤٹ ایگزام، تو آپ مجھے کمنٹس باکس میں نیچے بتاتے رہیں گے. اسٹیپ بائی اسٹیپ آئی ٹرائی کہ ہم سیشن کو اسٹیپ بائی اسٹیپ چلا کے اور پھر آپ لوگوں کے ذہن کے سارے سوالوں کو پورا کر کے پھر ہم آگے بڑھیں. I'll be keeping this session in 2 parts. For the very first part, I'll be talking about applying and MRCS Part A exam, study resources, duration hours, difficulty level, and is it a doable exam with jobs and so on or not. So let's begin and let's start talking about MRCS. MRCS exam is basically, most of we know that it is the membership exam for Royal College of Surgeons. This exam is conducted by different Royal Colleges like Edinburgh, England, Ireland, and Glasgow. Why people in Pakistan usually appear through Edinburgh? It's because of feasibility. Edinburgh conducts Part B exam in Pakistan, and it's the only Royal College at present who conducts Part B in Pakistan. The other centers currently do not have a center. The other colleges do not currently have a center in Pakistan. MRCS Part A exam is like a doable exam, but you need to be focused and you need to study a bit more than we usually do in our post-graduation life. And it's not like you have to do as a stubborn or a bookworm, but it has difficulty of around 7 out of 10. And in my experience, I was enjoying exam, and I have not seen any such exam in Pakistan where you go and enjoy the exam. And it's same for both Part A and Part B. When you go there, you see the environment, you meet people there, you appear in the exam, and in between exam, you see people faces. They are smiling, they are welcoming. They want you to clear this exam, and it's not something that's very difficult or that cannot be done by an average person. I've been average throughout my MBBS career. I've been an average student, but Alhamdulillah, I got it done in my first attempt. So MRCS Part A. What I suggest to people and what I say to them is, when you're appearing for an exam, you have to not clear exam. You have to know about exam very firstly. And what do I mean by knowing this exam is, if you know how exam is conducted, what do they ask and what can they ask, you can clear it very easily. But how to know all this? Like, there's no exam uh, anywhere which tells you what we will be asking from the candidates and so on. But every exam has syllabus. Like, for example, if we talk about MRCS Part A, so there's a syllabus for it. When I was appearing, I went through the whole syllabus and I came to know that they ask only one question from cardiothoracic surgery. Cardiothoracic surgery is a big section. Like, when you go start studying it, it consumes time, energy, and of course, it's not written in 5 to 10 pages. It's more than that. So they asked just one question, just a single question from whole that section. I personally skipped that. I'm sorry. And what did I do is, they asked around 8 to 10 questions from abdominal surgery, and I think this is how exams should be approached. My focus from cardiothoracic surgery specialty was shifted to abdominal surgery. I wanted to gain 8 out of 8 marks from abdominal surgery, and for that question from cardiothoracic surgery, I wanted to have a guess. If I get that guess right, it's good. And if I don't get that guess right, that's also not a big problem, not a big deal, just a single question. MRCS Part A exam itself consists of 300 questions, but it's divided into two papers. The first paper contains around 180 questions, and it is from the basics, applied basics. The whole basics is applied basic. Like, they can ask you basic anatomy or basic physiology, but usually there is a scenario, like there is a patient who got hit, and who got hit to a specific site of the body, and they'll be asking about the anatomy of that site, and so on. So those 180 questions from applied basic surgical sciences are a bit difficult to remember and a bit difficult to study. It's because uh, knowing the whole anatomy, physiology, pathology uh, puts you at stake in terms of that you cannot be sure of it if you have not studied. A very minor mistake, or if you select wrong answer, 1 mark is deducted. If you select right answer, you add 1 mark to your result. And how do they pass? They basically pass 40% of the candidates throughout the world. When I was appearing in this exam, I was more keen to know about the exam pattern, exam resources, exam syllabus, their passing criteria, and the people who actually passed it in their first or second attempts, no matter, but who passed it. I was more conscious to know what did they do right. So my suggestion to everyone who wants to appear in this exam is, you go in there prepared, you go in there confident, and you go in there with some prayers and blessings. The second paper of MRCS Part A consists of 120 questions, and those 120 questions are usually from applied surgical sciences. That what I found is, if you are in a surgical specialty, as I was doing my surgery residency in general surgery that time when I appeared in Part A, that was a bit easier for me. A bit easier because what we encounter daily in our routine, or what we go through daily, if not daily, every alternate day, we see cases, basic trauma cases, and their management. So it was a bit easier for me than the initial uh, first paper, which consists of 180 MCQs and is from the basic surgical sciences. The study resources which I made use of, and I think those were enough because I got good marks, alhamdulillah, from those resources. I usually make use of limited resources, but I make sure that I am confident and I know those things. And when I'm confident enough, then I appear in the exam. So for basic surgical sciences, I would recommend that you go with the rough theory. That's a very concise book. If you know it by heart, you know the basics. Not the basics for the exam, but you know at least the basics, which you should know before attempting any MCQ based paper or anything else. The second resource I made use of was the online subscription of past test. People usually disregard past test, but I purchased it, and the kind of person I am and the kind of resources I look for, past test was very helpful for me, like real helpful. It was helpful not only for me in doing MCQs or doing past papers. It was helpful when I needed explanation about a topic. There is an option on right side where you can go for expanded explanation. You can read the whole topic, and even if you don't understand, there are external links present at the bottom. So you just click on that link and you are taken to an external site where that topic is taught in a completely different way. So you have chances to understand that easily. But before doing that subscription or before going for any Q bank, people use EMRCS as well, and so on. I did past test. I would suggest everyone to go with the past test, and I'll tell you why I think so, why you should go with that. So when I actually did it past test, there was a question I still remember. I was doing it just a day before my exam, and that question was kind of, there's a patient who uh, has diabetes and developed diabetic nephropathy. Then patient underwent renal failure, and somehow he got renal transplantation. And after renal transplantation, the patient presents to you with elevated calcium. So what's the answer? What's the answer? What kind of hyperparathyroidism the patient is likely to have? Uh, Similar stem. This similar stem, not the similar scenario. Like concept was same, but words were not same. Came next day in my exam. It was similar, and it was like the patient had renal failure, got his kidney transplanted, and developed graft versus host disease, and now presents with hypercalcemia and so on. So it was like very much in my mind how to take that question, how to select the appropriate answer. I went with the option, and I think that was correct. And past test helped me in that perspective. Past test or any other Q bank will give you an idea of how can you approach these stems on exam. They will not tell you the exact scenario, but they will put it in your mind how exam can ask questions from you, and which answers are correct, and what do they expect you to know. This past test subscription and Rafteri was of more than enough for me. But was a book of past test revision notes. It contains two books, one and two. The second book has two volumes, one and two. Those books are helpful, and actually you can say the notes of past test online subscription. But past test subscription itself is very much helpful if you go through the debt confidently. If you read every question in that, it would be very much helpful. It contains around 4200 questions, what I remember, what I can recall in total. And if you have done 3000 or more, I think that's more than enough for you to pass exam. And I applied part A. I gave part A through the Royal College of Surgeons of England, because the documentation process of England is a bit easier. They respond to your emails in a day, and they are like very clear. You ask them for a thing, they will tell you the next day, and their process on their website is easier than Edinburgh. And you have to send documents through courier to their respected address as well before appearing in exam. Uh, this was all about part A, what I can recall. And yes, there is a gap in between two papers, part paper 1 and paper 2. When you appear for MRCS part A, you give you solve 180 questions in paper 1, and then you have a break of around 1 hour. You can take that break for 10 minutes and return to the exam station and start giving second paper, or you can take your rest up to 1 hour, up to maximum 1 hour. So it's maximum 1 hour and minimum it can be 5 minutes or 10 minutes. I gave paper 1, and then I rested around 20 or 25 minutes. I took 2 cups of tea, and then I went back and appeared in the next paper. I would suggest you to not take longer rests, like take 5, 10, 20, 25 minutes break and then go back. Because when you are solving questions, you are in a state of mind where it becomes a bit easier for you to continue. It's a bit exhaustive, but you have to make yourself capable of uh, solving around 4 hours paper or 6 hours paper continuously. If not 4 hours, at least 3 hours. So when you appear in the exam, you don't feel exhausted and you can clear that easily. So this was all about part A. If I have any questions from you people, you can ask in the comments box. Okay, so there is Mashal Fatma. She asked, is there any negative marking in exam? Basically, it's not about negative marking. There is no negative marking in exam. Which books and subscription are important? I told you, Rafteri book, past test revision notes, and past test online subscription. What I did, and I think that was more than enough. And how much that exam costs? So MRCS Part A costs around 550 GBP. Uh, Another question from the same lady is, and being a surgical resident, how much time it will take to get yourself prepared with duties? Well, I was doing my residency in general surgery at that time, and it took me 6 months to prepare for this exam. I gave around 4 hours a day, 3 to 4 hours a day, and there were gaps in between. It was not like I gave 4 hours for continuously 6 months. I gave 4 hours for 30 days, 20 days, and then took break of 5 days or 6 days, and restarted and so on. Then there is Sonu Karmani. House of time is enough for the first part of MRCS. Uh, so I think what you want to ask is if House of Time 1 year is enough for the preparation of Part A of MRCS. If this is your question, so yes, I did it in 6 months. You can do it in 4 months. I can tell you. I'm not that much good, and I think you are, so you can give it in 4 months. It's acceptable. It all depends upon you. The resources I told you about, you go through these resources, and if you think you can uh, go through all of those resources in 3 months, appear in the exam after 3 months. It's all up to you. I am a bit slow in study, so I took 6 months, and that was all for me. Any other question from you people? Okay, so no questions, we can proceed further. If there is any other question, let me know. I'm waiting for next 30 seconds. And then we'll start discussing the part B exam. How can we get that subscription? So you have to go to their website, pastest.com, pastest.com, and everything is written there. You select the exam, you take their subscription, you pay your fee, subscription fee online, and so on. And there is an option of taking uh, limited time access of around 48 hours for free of cost, if you want to have an idea how past test works. Okay, so in 1 year, how many attempts? Well, they basically conduct MRCS Part A after every 3 months. So 4 attempts in a year. And we are talking about MRCS Part A, not Part B yet. Okay, so keep it in your mind. After every 3 months, there is an exam, 4 exam per year. Well, I think what I suggest people is that you go through the basic text like rough theory and past test, revision notes, and when you have done that, before taking subscription, you apply for the exam. So you apply for exam like which would happen after 3 months. You have 3 months to go through the whole past test subscription, and that's more than enough. How much time before exam? So you can apply like we currently have in the month of April. There is an exam in the May, and after 3 months there is another exam. So in around May, you have to go through their websites. They will let you know about the dates, and you can apply around 3 months before the exam date. No, you need to have a degree as well as your house job certificates, and then you can apply for the exam. You have to send them your documents. They will verify that you have enough clinical experience to be their member, and then they will proceed. Fees is around 550 GBP for it's like 547 or 550. It keeps on increasing a bit. You can check on their respective websites, but it's around 550 GBP. Okay, so I think it's enough. I will be leaving my email address with you people in the chat section. So if you have any query, you can email me later on as well. I think we should move on to MRCS Part B exam for as of now. Yes, they take exam in the Pakistan. I gave both parts in Pakistan. There are Pearson View centers for MRCS Part A and dedicated centers for MRCS Part B. Okay, so let's now talk about MRCS Part B exam. And for remaining Part A questions, you can ask me directly on my email address. I will be leaving with you guys at the end of discussion. And you all are welcome for everything. Okay, so now MRCS Part B exam. Yes, of course. Even if you do your duty in Nepal, you can appear in MRCS. Abdul Basit Baloch. Okay, so let's proceed with the MRCS Part B exam. MRCS Part B exam is a bit professional exam. It's not academic. They do not test what you know because they know you have been through MRCS Part A. Mainly test your behavior, your professionalism, your attitude with patients, and how you approach patients and how you leave patients. It's not like they check if you have examined the patient correctly, if you have not missed anything. What they mainly check is your professionalism because they know you are appearing in a membership exam. You are not passing out as a specialist. You are just joining them to become a specialist. So they don't expect you to have very good examination skills or surgical skills, but they expect you to have basic skills, basic surgical skills. MRCS Part B has stations, and those all stations are manned. There is an what we say is those all stations are interactive. There is a examiner in every station, and they ask you to do things. They ask questions from you, or they ask you to examine any patient. They ask you to call a consultant in other hospital for transfer of patient or for any arrangements. They ask you to counsel a fussy attendant or like fussy wife of someone who just got tested positive for some malignant cells in their samples. So what I did for MRCS Part B exam was that I appeared through Royal College of Surgeons of Edinburgh in February 2024. And for your knowledge, up to date, only Edinburgh consists Part B exam in Pakistan. It's uh, it happens in Karachi, in Ahsan University Hospital, and in Lahore as well. They take 3 exams in a year, and there has been multiple emails to them for increasing the number of Part B exam, and they have responded good and positive. But up to date, only Edinburgh takes Part B exam in Pakistan, and it's only around 3 times a year, 2 to 3 times a year, not more than that. If you have appeared from one college in MRCS Part A, like if you have appeared from Part A from Royal College of Surgeons of England, and now you want to appear for Part B through Edinburgh, you can do this. But your degree awarding or diploma awarding institute would be the one from which you took your Part B exam. So, why people go for Edinburgh? The people who are working in Pakistan, because of feasibility. Edinburgh is more immigrant friendly, and like it's easy for you to get registered. You don't have to go somewhere and appear an exam. You can do it in your own country if you are from Pakistan. If you want to do or if you want to appear in exam outside of Pakistan, you can apply on their website. It's all there. And for MRCS, if you want to pursue MRCS or appear in MRCS exam, what you can do is to go through their websites, and you will be having all of the information you need. What I found is there are YouTube videos and many other videos on many other platforms. Those videos regarding MRCS are helpful, and their websites, those websites guide you a lot about their exam structure, when exam will be conducted, and so on. Even before the exam dates are opened, before a few days, they will tell you that on this date there will be opening for the exams, and you can be right there on the time when exam openings occur. So for Part B exam, what you can do is you have to go through a bit of knowledge, and you have to have professionalism in you. You have to have some skills. Those skills mainly consist of some suturing, some knot tying, or arranging an OT list, or excision of a skin lesion, and so on. Remember, they have actors. Most of the patients there are actors, but they behave very perfectly. Those actors do not let you feel that they are actors. They behave as if they are the patients. Even in the counseling stations, when you are confronted with an fussy attendant, the fussy attendant would not give any sign that the person is actor. They will behave as they are the patients or patients attendants. Even when you are taking history, they will not be showing any sort of thing which can tell you that they are actor. They will be showing as if they are the patients. Like I had a patient in history taking section who was coughing continuously. The patient was basically a case of post total hip replacement, and developed pulmonary embolism after that, and so on. That patient was continuously coughing and was showing that he has some shortness of breath and severe chest pain at that moment. So for MRCS Part B exam, as I told you earlier, before appearing in exam, just know about the exam itself. Just know what exams expects you and what exam can ask you. If you know what exam will be asking you, it would be very easier for you to appear and clear that exam. If you don't know what can be asked, it would be like very difficult for you For MRCS Part B, there are several stations. For briefly, we can say there are history taking stations, counseling station, procedural stations, uh, and skills station, and so on. So, what do they do? You go in this station and you have 1 minute around yes 1 minute exactly. You stand outside of the station. There is a scenario written on a piece of paper. You read that scenario. Bell rings. Then you go inside the station and interactive begins. And this interactive is like examiner. If there's a knowledge section, the examiner will be asking you a few questions and you have to answer them. If examiner asks you more questions, it means you have answered previous questions and he wants you to clear the exam. If he is slow in asking, it's very clear that you are not answering properly, and you can take a sigh and then start responding. And what I liked about MRCS Part B exam from Edinburgh, when I went in about the exam, like you sit there, they give you a brief presentation about how exam is conducted, what words should be spoken there and what words should not. Like CA, we make use of CA colon or so on. They expect you to not say CA. They expect you to say it is carcinoma or and so on, and don't use words like cancer or some malignancy in front of patient. They ask you to make use of words which are very much medical and professional, and so on. In history taking station, they will be. So we discuss about Part B exam in different parts. Like we begin from the history taking station, and I will be telling you about how to approach and what can you do to make examiner feel that you have the enough confidence and knowledge to pass this exam. So we start from the history taking station. In for history taking, the resources that you can make use of are, there are two notes which are Bazid and Torki notes. Those notes were very helpful for me, and those are very helpful for anyone throughout the world. Those notes have several scenarios, and usually those scenarios are enough for you to give you an idea of how exam stem can be. They do not tell you exactly about the exam stem, but they tell you how those stems could come in exam. For history taking, Bazid and Torki notes were very helpful for me. You go inside the station, you greet them, then they ask you if you have read the station. If you say yes, they will ask you to proceed with the patient. If you say no, I have not gone through the station, or I don't, I couldn't understand it, they will say station is written in front of you and you can go through this station again, this scenario again. Then you start taking history and so on. What resources I used for history taking were Bazid and Torki notes, and there is a book with name Doctor Exam. Yeah, there's a book Doctor Exam Part B OSCE book. That book is very helpful. It has two two books, one and two. I'm sorry, I think we've added something in between. Okay, so there is a book with name Doctor Exam Part B OSCE book. Uh, that book is very helpful in history taking. You can go through this if you find that helpful, good, and if you think that no, that's something cannot study or is time taking, you can directly go to Bazid and Torki notes. Those notes are very much helpful. For procedural stations, I would suggest if you are in a surgical residency, those stations are not that much difficult. Like they ask you for not tying or suturing, and so on. They ask you to select filler sutures, like they ask you to take a suture which is multi-filament and absorbable, so you take the respected suture and so on. And for stations like excision of skin lesion or arranging an OT list and so on. For communication stations, like where you have to communicate with the patient, counseling and so on, I would suggest you to have some practice practice with your partner or anyone you have around you who can help you. If that person is a medical professional, medical student, graduate, PGR, postgraduate resident, that would be good. And if not, even then, you should practice it at least 5 to 10 stations, 5 to 10 times. If you examine a patient uh, before exam, you can do it in the exam very quickly. And they don't expect you to do the examination of the patient completely. They expect you to show professionalism and attitude. Your attitude towards the patient matters a lot, and they are very much concerned about washing hands. They are very much concerned about how you introduce yourself. They are concerned if you help patient dressing, uh, and if you ask patients, if you are very much empathic towards the patient, you help patients in dressing, you help patients in sitting up, lying down, you ask if the patient has any pain and so on. They are very much concerned, like they, you will feel during examination that examiner is uh, literally uh, trying to hear clearly what you are doing or see clearly what you are doing. If you will come in front of the examiner will move to a side to have a good look of how are you are examining, and if you are causing any distress to the patient or not, and if you are telling your steps to the patient. And what I can tell you is there is a key in all this, and that is when you are doing something with the patient, is speak to the patient, say everything you are doing. Like when you're checking their pulses, say, now I will be going to feel pulses in your hand, which are there because of the presence of arteries in your hand and so on. If you are going to percuss, you tell them, I will be tapping a bit on your chest. It won't cause any pain or discomfort, but if it does so, you have to let me know. And examiner is like very much interested in these things, how you are talking to the patient, and if you are showing any empathy towards the patient or not. In and examinations are like doable in this exam in MRCS Part B. Examination stations are doable. Those are not something uh, they expect. They don't expect you. They don't expect a lot from you, from anyone who is appearing. What they expect is empathy and professionalism. And apart from this, I will be answering to your questions at the end of the discussion. We will be having 3 or 4 minutes, and then I will be answering every questions that you have asked. So, if we go ahead, there are stations like when they ask you to call some consultant from other hospital for some referral or some discussion. In that station, the consultant is very much friendly and very much talkative. If you don't tell him anything, he will be asking things from you directly. You just have to answer. Make sure your answer is correct. And they usually give a file of a patient before that station, and you have around 9 minutes to go through that, and then you can discuss with the consultant over phone call and tell them every detail that you have about the patient and so on. If we go ahead and discuss about other stations like knowledge stations in particular. In knowledge stations, they expect you to tell the exact word they are asking. Like I remember there was a station of esophageal carcinoma, uh, and yes, do not remember this whole TNM staging and so on. It's not asked in the examination, and if it is asked, it's written in front of you. There was a station of esophageal carcinoma, and TNM staging was written on the desk, and examiner asked me, told me that this patient is there. Here is the patient's histology report, and you can see the TNM staging on your desk. Now tell me what stage patient has. So there is no reason of remembering all this. As I told you earlier, they don't expect you to know things. They know you have cleared MRCS Part A and you know things. They check your professionalism and your and how confident you are. So in that station, he asked my questions and so on. There was a question and I gave him answer, and he said no, it's not. So I was like, can I come to this question later on? He said yes. He asked all questions, and in the end he said, you have answered every question. I want you to answer this question as well, but until you say the exact word to me, I can't pass you. I can't give you mark for this one. So I took a sigh, and then I gave him the answer, and he was like, yes. So I asked in the end, how did I do? He said, you were good, you were fine, and so on. They don't talk more than this, but they tell you if you did good or not. Most of the examiners usually say that you did good. They don't tell you that you did bad, because they want you to stay motivated and appear with a different face in every station you go through. When you will go in a part B exam and will sit there, you will be having their presence in front of you. They want you to know and will tell you what not to do in the exam as well. I think that's more than enough. We can have some comments or questions from you people. You can ask me, and I will be giving my email address with you people as well. I think you all have got the my email address as well. If you have any query about this exam, you can email me. I will be trying to of utmost value and will be responding properly what I know about the exam, and always available for you people. What you people can do in return for me is to remember me in your prayers. So, do we have any question from the MRCS exam? Okay, so there is Spray Hassan. I missed the initial part. Well, you can see this video again. It vanished. You can see this video again. It vanished, doctor. I sent my email. Did you people receive it? OET exam is not OET needed for part B? No, Bhisham. OET is not needed for part B. OET is needed when you are applying CS exam. You don't need OET for part B. And part B fee is around 1,047 GBP. Is there aim asked? Is there any rule like if someone is unable to pass part B, so his part 1 becomes null or void? Can give 4 MRCS part B attempts, and you have to clear in those 4 attempts, or you can appear in SEP can appear up to 2031, and you have only 4 attempts to clear the part B exam. Overall scope of MRCS along with FCPS in Pakistan, sir. MRCS gives a bit of verge here, but MRCS gives a bit of edge here, but it's not very much endorsed by. Nitesh asked, what would you recommend if a person wants to enter UK via MRCS pathway rather than pleb right after house? I would suggest if you are going to UK, even if you go there after doing your pleb, you have to appear in some of the membership exam for starting your higher surgical training or any residency. What I suggest to people is that you do your house job, you give your country exam for residency, you start residency in your country, and then you appear in these exams. And even if you don't do that, instead of going for pleb, go with MRCS. A bit difficult route, because when you do pleb, you go there after GMC registration, you create your contacts, you work there in the NHS, you do observerships and so on. You make your CV strong and then apply. So a bit easier. But even after that, when you have to go for residency, you have to appear in some membership exam. The other route is you give membership exam from Pakistan or from your respected country, and then you go to UK and start your residency there. Any other question from people? And have you people received my email? Pathway after passing MRCS aim asked. If you have passed your MRCS exam, you have to appear in OET, and when you have cleared OET, you can apply for GMC registration. And after MRCS, college will give you diploma. They don't ask for OET. They will give you diploma. But for GMC registration is like PMDC registration. For working in UK, you need to have GMC registration. So MRCS itself stays as a reference for GMC, and you can work them there. Pathway after passing MRCS and you can work them there. Pathway after passing MRCS with FCPS, there are some equivalency which they give you, like if you have training, you can directly go to their ST3, but there is an issue. There are two specialties, they don't take candidates directly into that, and those are cardiothoracic and neurosurgical specialty. For these two specialties, you have to work there from the beginning, and for other specialties like general surgery, urology, pediatric surgery, plastic surgery, and so on, you show them your experience of FCPS here in Pakistan, you show them your MRCS, then they take you directly to the ST3 and this protocol and this all things change. Yeah, of course, it's like MRCS is do AMR to we have to do residency there separately. Yes, of course, makes you eligible to do residency there, but it's not a specialty exam. After part B, what can think to do next? Well, after part B, give OET, and OET plus part B, then go there and work in the UK. If we have, so I think we are done with this, and I hope it helped you people. My email address is ahsanwaqar42@gmail.com, ahsanwaqar42@gmail.com. You all are most welcome for that. I hope most of your questions are answered, and if there is anything else you need to know, you can email me directly. No, after MRCS, you cannot work there as a consultant.
Thank
Okay.
you so much,
Just I need to
Dr.
explain.
जी, thank you so much, Dr. Ahsan, for your worthy time. Really means a lot. बहुत माशाल्लाह डिटेल्ड सेशन था और बहुत बेहतरीन सेशन था, जबरदस्त. बहुत शुक्रिया.
Thank you so much.
Thank you so much.
Email address is ahsanwaqar ahsanwaqar42@gmail.com.
आप आप दोबारा व्हाट्सएप ग्रुप पे भी शेयर कर लें, एहसन भाई.
जी श्योर मैं